today, and we have the lovely Andy Gardiner, who is giving up his time to help you, the dog owner, understand your dog's condition more, understand all of the things that you can do to help manage it. So, Andy, just tell us a bit about yourself, because you're quite amazing. So, you're picking yourself up.
Well,
you might need to change your camera angle a little bit.
Yeah, sorry, I'm kind of.
That's all right.
I've got the charger in the phone, and it's kind of wiggling around all over the shop.
Oh, that normally happens to me. That's perfect. Can you do that?
Yeah, I can't guarantee it's going to. Whoops.
This is where you need blue tack.
So there you go. I'll just hold it there.
Cool.
Yeah. So yes, I'm a physio. I started off in the NHS a little while back now. I guess back in 2002, 2003. And I worked in a multitude of settings, be it sort of musculoskeletal settings, orthopedic settings, neuro settings, and so on. I finally went on to sort of kind of specialise the latter part of my career in cancer and palliative care. Just close that there. And yeah, it was probably about sort of, forget the time frame, but it was sort of 3 or 4 years ago I decided that I kind of wanted to follow my passion, which was dogs. Principally dogs. And took the opportunity to study veterinary physiotherapy at master's level. Studied at Hartbury College, and I was just by sheer good fortune, a job came up in Southern Counties veterinary specialist, and that was whilst I was during my studies as well. And they took me on as a kind of a sort of student.
Really, they took you on?
I was really lucky, and I've been there since. And yeah, it's a great place to work. The thing I particularly like about it is, as referral centres go, the vets are very multidisciplinary team minded, so it's a great environment to work in. You get a chance to really sort of add a little bit of quality to the all round care that you can give the animals there, and yeah, very much enjoy it. So it's all good so far.
And what's your main caseload? Because like, as a human physio, I think a lot of people always think it's all musculoskeletal, and as a human physio, you have to do quite a lot more, don't you? Like the cardiorespiratory and stuff, but with veterinary, it's very much more musculoskeletal, isn't it?
Yeah, so I mean, certainly in Southern Counties, I would say the mix is probably 50-50. So we have quite a large orthopaedic caseload. So that's certainly, we see a lot of dogs that are having TPLOs, total hip replacements, and so on. And then we see a considerable amount of neuro as well. So a lot of dogs with intervertebral disc disease, type 1, type 2, those that have had the FCEs as well.
Oh my God, this is another episode. I'm going to so get you back, because IVD does not get enough attention. And the conservative management and the type 2, I really, can we do an episode on that as well?
Yeah, by all means, yeah, certainly. So yeah, I mean, it's a separate discipline, isn't it, really, in its own right? But yeah, so we're really lucky at Southern Counties. We get to see a great deal of different cases, as I say, orthopaedic, neuro. We then take external referrals as well. I'm sorry about this, Hannah. My phone is really playing up.
Don't worry.
I've just got a horrible feeling it's going to run out of battery, so bear with me 1 second.
Don't stress. This is why live is always quite hard, and the more professional you are, the less likely you've got any IT experience.
So yeah, so what did I say? So a lot of ortho, a lot of neuro, and then we take external referrals. So those dogs with long-term conditions such as osteoarthritis and so on. And all manner of things in between. So yeah, we're lucky. We get a good variety, and I work with a team of clinicians. As I say,
you have a pretty big team, don't you?
I'm pretty lucky, really. I'm the first one to say it, really, and the fact that, I mean, certainly from when you're dealing with some of our dogs, the consultants there, the specialists there, are very open-minded, and we just discuss sort of goals together and treatment plans together. So yeah, it works really well.
And you have, I was checking on the website, you've got 2 hydrotherapists.
Yeah. So actually, we've got 4 hydrotherapists. We've got myself and Sam Gifford, who's a veterinary physiotherapist. And we're very lucky as well. We've got Danai as well, who you met in Ghent.
Yes, don't talk about Ghent. What happened in Ghent stays in Ghent.
So, and she's studying canine sports medicine and rehabilitation. As a resident there, so we're really lucky with that as well. So we get that sort of veterinary input, as well as the sort of physiotherapeutic input as well. And certainly with the team of hydrotherapists that we've got, again, very lucky. I'm not just plugging them deliberately. I'm just
no, but you're allowed. I think that's really fair. Like Cam, just so any new viewer understands Cam, we're trying to be as independent as possible. We're trying to give relevant, empathetic advice from people that are working on the front line. And we don't really want your content to be biased. And the only way that I feel that we can do that is to have real people in real jobs experiencing it real life to give you advice, and they do it free of charge. So Andy's here giving up his time this evening free of charge. So if he wants to promote where he works, I'm totally a-okay with it.
Well, I think the main driver really from this is the fact that we work as an MDT, and I think it's kind of, if you're going to take something from the sort of the human model of physiotherapy and indeed sort of medicine, and sort of extrapolate that into the veterinary setting, it's about working as an MDT, as a constructive MDT.
What do you mean by MDT?
So in the hospital setting, we talk about as being a multidisciplinary team, liaising together, working together. In a general hospital, that would be the doctors working with the physios, working with the nurses, working with the occupational therapists, and particularly if you're on a rehabilitation ward, combining all those skills together to get the best outcome for your patient.
Okay.
And that's why I feel...
Just keep your phone a little bit still, because you're
Sorry, that's because I'm holding it. And I think that's what we do quite well with the team that we have.
Yeah. Okay. Well, let's crack on, because I met Andy again. I basically stitched him up as soon as I saw him and said, right, and we only since that point spoke for about 15 minutes today, and I just went mental, because I was like, oh my god, we had got so much in common, because I think we both know every intervention requires foundational treatment, doesn't it? It needs a foundation. So take it away, just carry on the conversation that we started this morning. I think it was this morning.
So I kind of certainly for arthritis, for me, I kind of look at it from two perspectives. So you're dealing with a set of dogs, perhaps in that later stage management, and then the other aspect of it is I'm quite interested at the very early stages, or if you like, these preventative stages. I'll discuss that a little bit later on. Certainly from the sort of those more advancing stages, and I guess the way that I like to approach my patients is to try and come up with treatment plans and techniques which are relatively simple. So certainly in terms of things like if you're prescribing a set of exercises for a dog, and you're asking these owners to go away and do these treatment plans, it's being mindful of just how much that they're actually going to do and how much that they can realistically do as well. So I think we know certainly from sort of the human physio setting that if you set rehab plans and exercise plans which are a little bit too elaborate, the chances that they're going to do each and every single exercise and do it at the level you want it is probably a little bit remote, if I'm honest. So it's about making sort of treatment plans that the owner can do, sort of actively engage with, and keeping it straightforward. And another key factor for me is all about education. So it's educating the owner a little bit about the fundamental. So, and we spoke about this earlier today.
We've both been at work. We're like, when did we speak?
So there's a little bit basic sort of fundamental anatomy of a dog, and I guess the key point for me is making them aware that the anatomy of a dog pretty much mirrors their own. These sort of the joint structures that are involved, again, they sort of very much resemble our own. The bits and pieces that make them up, again, very, very similar. So if you use and abuse those structures, you're potentially going to predispose yourself to a problem later on.
And I think that is, let's actually start there. And then I think what we'll do is we'll then drift into older, senior, progressed OA management. Then we're going to bounce back and do young dog, because some of our most loyal followers are the ones that have had a diagnosis really early in life, and they're like, holy moly, my dog that I was going to hill walk with, I've now got to manage. And then me and you are going to go a bit crazy on preventative, because it's something really, really fascinated in. So let's just play with that thing about, owners needing to understand that we have similar muscle type, structure, function, And therefore, with it, hopefully can come better understanding, but also I feel better empathy. So at the moment, guys that follow this page, I haven't got gout. I have got a fascial tear in my so I keep mentioning this every week that my toe really hurts. And I've had it checked out. I've had my diagnosis and I've got a plantar plate tear. And it hurts. It really hurts. And recently, because I've been driving around the country, I've taken on a very poor posture because I've got an inappropriate chair in my car. So I've got really tight through my hip flexors, which has caused my IT band to really hurt. And soft tissue pain is really painful. And I take this empathy I've developed now because I understand how painful it can be to managing my cases. And they do say that you need to experience pain to empathise, you know, so a lot of people that become chronic pain specialists care because they know what it's like. Mm-hmm. And I wish that we were allowed to take our kind of anthropomorphism that we have that next step. You know, let's understand that animals do feel sensations similar to us. So if you know what I'm trying to say, that's for me the first part of education. When I speak to my owners of a recently diagnosed case, is I spend quite a lot of time trying to get them to understand the expression of pain, the subtle indicators of pain, and the fact that animals do feel pain. So when they slip and they fall and they trip and they stumble and they struggle to get up, that's likely pain. And I am not scared of using the word because I feel it gets people to act there. Then they don't delay, they don't wait till next week. Am I playing it too near the bone, or do you agree with that?
No, so I agree with that. So I've heard sort of previous interviews that you've done with past people on, and in particular the one that you did with Jamie the other week, which I listened to. And the key point that you made up there was talking about owners, particularly if they've got flooring, they have tile flooring, laminate flooring, getting the flooring covered up with rugs and runners, because at the end of the day, dogs need grip. And so when you see dogs slipping and sliding around, it's, you know, not just what they're doing to the joints, but the muscles, the soft tissue, and so on. What are you doing to those soft tissues when they're slipping and sliding around all over the shop? So to try and get people to empathise with that a little bit, I kind of say, so imagine yourself on an icy day walking out on the street, and then you slip and you slide, and quite often you either feel it at the back of your knee or you feel it in your back. If you've got a dog that's doing that over and over and over again, can you imagine, you know, the potential for sort of long-term damage that you might be causing with your dog slipping and sliding all around the shop? So I try and put them in a similar example, to try and get, again, some empathy with what the dog might be experiencing, slipping and sliding all over the floor.
Yeah, you would like it. You have to go back probably about 6 months, and I started doing #reality check, and I would take a video clip of me doing something, and one of them was a brilliant one where I've been to the gym and I've had a personal trainer beast me.
Yeah.
I had delayed onset muscle soreness for about 4 days afterwards, and I filmed myself walking around the house going, huh? Because soft tissue pain is painful.
Yeah.
It gets neglected, and that's why I really love having physios and people that work in the soft tissue sector to contribute. And people really focus down on the joint, and that's just part of a bigger picture. Let's go into education. Let's talk people with arthritis from a physio point of view. You know, tell them how you see the disease developing and the consequences globally on the body, and therefore how your brain might look at that case when it arrives. And your case that we will talk about is a 11-year-old spaniel. It's had 2 unattended to cruciates.
Okay.
Bulky, not moving, grossly distended. And it's also got shoulder tendinopathies because of weight shifting. So that's your dog. It's going to turn up. How does your brain work like a physio so people can get a better understanding of the disease and how big it is?
So in that sort of instance, I try and so when we talk about arthritis, I try and sort of lay a foundation of what arthritis is, and why it is caused, and then why in particular with a dog that's ruptured its cruciate ligaments might be getting wear and tear in its knees and causing this painful pattern around its stifles in the first instance. So I'm always quite struck by the sort of owners and indeed professional dog handlers, how little they know about their own dog in terms of its structure and function. So the number of people that perhaps don't understand that their dog has cruciate ligaments like we have cruciate ligaments, and sort of relate that back to ourselves, that if we were to rupture a cruciate ligament, just how much discomfort and problems that might cause long term. And then if you go along long term without treating an unstable joint, that this pattern of inflammation and so on is just going to...
Where's the pain coming from? So my friend, she did her cruciate. She was hobbling around for a very long time. And that's something I could just tangent slightly. When I looked at her and the fact that it went on for weeks and weeks and the pain wasn't dissipating and she was doing everything correctly, but it was still painful. Whereas we see our dogs who are amazing copers seem to accommodate it quite quickly and they get on with it. I don't think it means that pain hasn't really gone. They're just like, right, I've got to adapt and I've got to plow on. But where does that pain come from?
Well, for me, it starts within the structures in and around the joint, and then you start to get a pattern of inflammation, which then starts to cause more discomfort locally within the joint. And then you start to get sort of bad patterns of movement, poor postures, and so on and so on. And then you start to get secondary problems as well. So you might start to get sort of discomfort and so on through other soft tissues. And then because they're sort of coupling up the muscles perhaps through their back to try and offload the weight to the forelimbs, you might then start getting sort of secondary discomfort down to the back, and then an overloading of the forelimbs and so on. And so you end up with this sort of widespread pattern of discomfort. Yeah. And sometimes with these sort of dogs, it's trying to unknit what you're seeing at first. You start unstitching one pattern of pain to only perhaps reveal another, and then so on and so on, until you localise it back to the source that perhaps is the primary condition in the first instance.
Yeah, and I think that's, I have a massive respect for the rehab physio sector, because I didn't get taught like that at all. We got at university taught in a very disciplinary approach. So you got neuro taught, and then you got orthopedics taught, and then you got we didn't touch on soft tissue very much. Mm-hmm. Now that I am starting to enter this world and start my journey, I'm like, it's like peeling an onion. There's so many layers to uncover. And now that we know so much more about like fascia, whoa, that's amazing. So you're right. It is about peeling off the layers.
So I think it's kind of it's using a little bit of clinical reasoning when the dog first comes in, and you're presented perhaps with a pain pattern and you start focusing on that, and then you.
What do you mean by a pain pattern? Tell people what you mean by pain pattern.
So whether with your dog's coming in and you start sort of palpating around your dog, and you're feeling a sort of particular area of muscle spasm. Which you think, all right, I'll start sort of treating this area first. But in fact, the problem might be sort of wound back further down the body or down to a different limb and so on. It's just that the dog is starting to compensate in such a way that you're getting these patterns of pain in different areas of the dog's body, which then need perhaps sort of going back to the source before you're going to effectively treat the other.
Yeah, and as you say, a pattern means that they're kind of often recognisable. So I had a dog in the tank earlier. Its second it's had a lateral suture, second side. The last one was done years ago. But the more acute presentation of pain isn't the surgical site, it's the diagonal shoulder.
Absolutely, yeah.
And actually the hind limb is offloading into the left hind limb, and we've now got lots of discomfort and restricted in around the hip flexors. And
so, for instance, we had a dog today, a lovely little staffy that came in. Who's been treating initially for sort of rehab from intervertebral disc disease. He had a type 1 disc extrusion. I think it was around about sort of T13L1, sort of typical area where they have that problem.
For people that don't understand what he's just said, mid back and the disc goes.
Yeah, basically the disc hardens and then it sort of ruptures through the annulus fibrosis and then into the spinal canal, and it creates a bit of compression on the spinal cord, which then has to be released. And a problem with that is you get weakness with the dog's back legs and so on. That's a really simplistic way of explaining it.
Yeah. But it's good. That's good. Don't do a Danny on me. She's
So the dog had been rehabbing really quite well, and then she came in the other day, and its left forelimb lame.
Yeah.
And so you start having a look around that limb, and then what's happened is the dog's offloaded to such an extent that it generated a secondary problem at the forelimb, which then needed, an approach to try and deal with that as well. So, when you start getting these offloading patterns and sort of generating discomfort in different areas, it's why is that happening, rather than necessarily going straight into that problem and not considering the other aspects as first. So it's using a little bit of clinical reasoning to wind it back as to why you're getting those symptoms in the first instance.
Yeah, and I think that a take-home message. So I try being the invigilator, the person, to give take-home messages. A big take-home message for me, whilst we're talking to Andy, is pain doesn't just come from the joint. It comes from around the joint, from proximal up the limb, down the back, forelimbs. It all starts getting involved. And the reason that we see this a lot worse in dogs, in my opinion, is that they have amazing coping strategies. They can offload very well, they can accommodate the discomfort, and they cope and they cope and they cope, and then eventually they can't cope anymore. Yeah. And you see these dogs that have huge amounts of change that you have to unravel. And that's what Andy's trying to say, is that when we see these established cases, we have a lot to deal with. It's not just a case of focusing on that knee or on that hip. The whole dog. Something else regarding pain, do remember that pain can come from muscle, it can come from ligaments, tendons. There's other structures that can create this source of discomfort. What do you do when you've got the dogs that are really painful? So physios, you have your area. What happens when you start getting the centrally sensitized allodynic, you're not able to touch them? I want to just complete the pain picture for people. People coming onto a platform, they've only ever considered the pain of arthritis would come solely from a joint.
Yeah.
We've told them it can be compensatory and soft tissue related. What about when it's neuropathic?
So this is where I'm really very lucky. So we have, as I said to you before, we have Danai that's doing a canine sports medicine residency with us. So she's now opened up a pain clinic. So with those dogs that have got these really stubborn patterns of pain, we can escalate it really and start tapping them into pain clinics and so on, where she can start reviewing the medication, changing it up to get the best combination of drugs to sort of try and control that in the first instance. And then possibly use things like acupuncture, possibly use things like laser and so on, and starting increasing the level of anti, if you like, to try and deal with it in the first instance.
Yeah, and for all the followers that come to the CAM page because they've come because they don't want to use medication and they go online. So we see this all the time. They go online because they're trying to find a different pathway because they've got fear of medication. Another take-home message is Andy's just said that he works with people that can provide pain medication, because he might need the door to be open for him to get in with his other skills, and that might require medication. And when he gets in with his skills, then the medication might not be needed anymore. But I think there's a lot of people that are so in fear of medication, but you have quite confidently said, no, it's part of your team.
Yeah. It's as I say, so for me, it's a very much a multidisciplinary approach. And it's kind of, if you want physio to be effective long term, or even in the short term for that matter, you have to try and modulate the pain in the first instance. There's no use giving a dog a battery of exercises to do if you haven't controlled the pain in the first instance. So for me, sort of physio, when you're sort of starting out, is can you look at the pain? Can you sort of have can you treat the pain in the first instance? Does it need something other than physiotherapy to get on top of it? Then once you've got that, then you can start to work on function and so on a little bit.
I love that. And that's brilliant. This is a really resounding message from most of the people that I interview who want to talk about pain, is that multidisciplinary approach. If a dog is carrying pain and you're pushing it through something to get functional improvement, you're not going to get there, because they're going to still offload, they're still going to adapt their posture, they're still going to prevent them using the area that you're trying to maximize the effect. So if you have got a dog that has got really painful stifles, sits to stands, no, sorry.
No, absolutely not. And it's other things as well, sort of even things like sort of cavaletti poles. I've seen that done quite poorly, and this is sort of generic set of exercises which, if the dog's got the ability to do them, can be used to really good effect. It's what worries me is when they start to become generic. The dog's got arthritis, it's got an arthritic stifle or so on, or it's got a poor hip. We'll give it sit to stand exercises because that will strengthen up the glutes. Well, maybe that's not the most appropriate exercise at the time. Rather than just reading off a battery of exercises and applying it to the dog for that condition, I think you need to use a little bit of clinical reasoning in the first instance to say, actually, if I give this dog this set of exercises, is it able to perform them effectively to then get the effect that you want later on down the line? If you can't, you need to wind it back and maybe look at other things that are a little bit more simple and get that established first before you then escalate your exercise plan.
I think sometimes I'd say that physios and therapists can be pressurized by owners to start
very much so.
action plans. And I think I've seen it before where owners, like I did some work experience with Danny. Yes, I still do loads of work experience. And I drove down to Lichfield and spent 2 days with Danny at Pool House Vets, going to pick them up because Danny is great. And she does a lot of soft tissue work with the support of the water in the underwater treadmill. So, some people less educated might think that she was just feeling a little bit, just a bit of job to see you later, because she's not making that dog stride out at high speeds on the underwater treadmill and do something. And she's like, whoa, that would just cripple the poor beast. So I think we do, as therapists, sometimes feel the pressure to try and provide something that's going to be appetizing to the owners, and we should go, no, it's not about the owner.
For me, that's where your education starts to be key. So it's sort of when you're walking your dog, so when you're doing your trot ups basically, and doing your gait analysis and so on, it's educated. Am I bouncing the phone up around? Sorry. So it's about when you're doing your gait analysis, it's feeding it, telling the owner what you're seeing, so they can learn to understand it for themselves. Rather than sort of being guru about it, to sort of explain what you're seeing and teach them so they can identify those particular patterns or those particular compensations, so they can sort of recognize them in the future if they become a problem again.
I think that's something that when we rebuild the CAM website, I really want to have a library of gaits and abnormal gaits, so people can question what they're seeing and realize that walk that their dog has done for the last 2 years actually is abnormal. And just finishing about cavalettis, because someone said music to my ears, I went to see one of my friends, and he won't mind me telling the story because it was amazing, and I've got video footage because it is amazing. So he was advised by somebody to do cavalettis with his very, very senior black Labrador with many mobility issues. And I went round and he was all proud of himself. Like, oh no, come on, look what Bash can do. And it was a donkey on speed going over these cavalettis. And it was not constructive, if anything, seriously dangerous. And I was like, right.
Where do we start?
Where do we start? Because these things you can buy online and you can just start using. And I don't think, I know what I've learned a lot in the last 5 years, and it's a lot. And I've always been a dog lover, and I've been a vet for quite a while now. My learning curve in the last 5 years has been huge. So if I was to be a normal dog owner, I would like now to think that I'm going to put my hand up and ask for some advice, because it is complex. And seeing appropriate movement in an exercise to make sure that exercise is going to work is really, really important. Let's just talk about some of the skills that you physios do. Then we're going to talk about the younger dog with OA to give that readership, lots of direction and hope. And then we're going to talk about preventative. But talk about some of the stuff that you do, because people just go, I go see physio, and people go, what does that mean?
Okay, so there's sort of various techniques. So I guess the first one that people sort of relate with physio is the sort of manual techniques that we'll use, and that can sort of encompass everything from massage to gentle joint mobilizations, and sort of what we called, I guess if you look at it in sort of human physio, you can see them doing sort of sometimes these sort of oscillations on a joint, or sort of what they call manipulations and so on. So you've got that sort of manual approach, and then you use exercise as well. So it's exercise therapy, sort of constructing sort of exercise plans which are appropriate for that sort of condition to try and get the best out of the function that you're trying to achieve. And then we have electrotherapy and so on. So you've got your lasers, you've got your ultrasound therapy, and then your muscle stim and so on. And the one, again, I keep banging on about it today, kind of education for me is very much a part of that set of skills. In fact, for me, that's probably the most fundamental out of all of them.
I totally agree. Cam was set up right at the beginning as a Facebook page to try and inspire people to manage their home environment better. Yeah. So if you guys scroll back to like 2015, at that point I was called Southern Coast Garland Myotherapy, and it had been because I'd gone into people's homes and they were spending money on drugs, they were spending money on therapists, hydrotherapy, massage therapy, and you went to their home and the dog was tripping over the Hoover, falling down the stairs, slipping on the patio decking, and I was just like, this is crazy. Why are we just getting the foundations in place? So yeah,
well, I guess if again, I swing between the two from my human skills, and I bring those back to the veterinary setting quite a lot in terms of my education, and I think we spoke about this earlier today. It's empowering people to look after their own health at the end of the day. You can't do that without educating them in the first instance. So what can you do to look after your own musculoskeletal health long term? And I think that's directly applicable to the dogs that we see as well. It's kind of, it's not necessarily about what I can do for your dog in that half an hour that it's with me. It's what you then do for the rest of the 24/7 that dog's with you. Because my hands and so on, if I'm doing a particular piece of manual therapy, that effect is not going to go and last if you then take your dog home, walk it in the park and blast it with the ball for 30 minutes.
What's your feelings about ball throwing, Andy? You can get some hate mail too.
So I'll caveat that first. Do I have a problem with a dog playing the ball? Absolutely not. Dogs love balls and so on. And to take those sort of things out, which are fun for the dog and the owner, would be particularly mean. My problem comes is when the thing is particularly when it's misused. And I think particularly when your dog is starting to sort of demonstrate problems, and I say to owners is change the nature of the game. It doesn't mean you have to take the ball out of the equation, just change the nature of the game. So rather than throwing it sort of umpteen times down the field and doing that sort of 7 days a week, because in essence, I'll give you a little story. A guy that came in with a collie who had raging lumbosacral disease, showing nerve root signs and all the rest of it. And they were going to try conservative management with him in the first instance. So when I start my assessments of the dog, I really want to know what's going on. So that subjective assessment that you do at the initial, I really want to know what's going on in this dog's life, particularly over a number of years. So we got to the ultimate question: do you play toys? Do you throw the ball? And so on and so on. He goes, oh yeah, we throw the ball all the time. I said, oh, okay, fine. So when you're out for a walk, how long will it be? And I said, probably we go out sort of 2 hours a day, and the first walk will be about an hour. And I said, within that hour, what are you doing? He said, it's this ball all the time. So I said, 10 throws, 20 throws? 30 throws at least. So I said, and you do that on every walk? Oh, yeah. So, okay. So we'll add that up then. So that's 60 throws. I said, and you now multiply that by 7. And he said, oh, right, okay. And he said, we'll add in the sticks that we throw for it as well. So then when you start to pull it apart, you've still got a dog that's doing high intensity interval training. So 2 sessions a day, 7 days a week. You are going to end up with a raging problem. I feel you're going to end up with a raging problem if you do the same thing time and time again. So, ostensibly, a dog playing with a ball on a walk, with a handful of throws, may be. But it doesn't mean you have to do it the day after, or the day after that, and the day after that. Rather than throw the ball, go and hide.
I wish ball chuckers has never been invented, because I feel a lot of owners see them in the shops because they're everywhere, and feel that they're a good owner for providing stimulation to their dog. You know, you're not a good dog owner if you don't go out with your lead and your ball chucker. It's part of the uniform almost. And they're so misleading. And if I had a parallel life, I would protest out of every Pets at Home on a regular basis. People would start to say, Hannah, you have a problem.
Dogs love to use their nose, don't they? Dogs, you know, they're really sort of sense orientated.
Yeah.
So it's kind of so engage with your dog a little bit more. So you make it sit, make it wait, take the ball, go and hide it behind a bush, hide it behind a tree, and then send it off. It gets the run out, and then it has to engage its brain and sort of search for it. And I think it's a much healthier game long term, rather than continually throwing this bloody object up and down the field. And you see people that will sit on the park bench and just lob this bloody thing time and time again. So
we did a shout out about it about 2 years ago, and we asked our viewers of ways that we could encourage owners to reconsider that activity. And one very wise person said, imagine you have arthritis in your shoulder and you used a ball chucker again. You wouldn't do it to yourself. So why do you do it to your dog? And I thought that was really a good example. I love this comment from Alex Comments. You're a winner in my book. It's a shame when you have to persuade an owner to buy a runner for the hallway to stop the dog slipping daily versus an inflatable wobble cushion that will not be suitable for their rehab. The basics are not sexy. Thankfully, they bought the runner, not the wobble cushion. So mini win. I totally agree.
Yeah, absolutely.
I was talking to Professor Matthew Allen. I'm going to drop that name in there today. He's a professor from the University of Cambridge. And he too said, yeah, we need to promote arthritis. It's just not sexy enough. We need people to be interested in this disease because it's huge and fascinating. Just finishing off the ball thrower thing, I think we need a behaviourist in our chronic pain team. And I think we need people to have the dog trainer, the behaviourist that can re-educate owners about what the dog needs behaviourally and how to change behaviours that are not good for their physical state. What do you think of that?
Yeah, well, that's probably the thing I was going to talk to you about next. So it's kind of, for me, it's fundamental sort of dog behaviour really, and I see a lot in the clinical setting what I call these lovable lunatics. They're normally black Labradors, and they come in and they are full of beans. They are bouncing and charging around the place because they just love life, and it's lovely to see. And then you talk to the owner about, does this dog, does it behave like this? Oh yeah, he's on it all the time. He sort of bounces on and off the sofa. He charges up and down the stairs and so on and so on. It's difficult to tire him out. So this is, I think, the new weapon in our armory is good dog behaviourists, good dog trainers. You know, if you've got a dog that's behaving like this on a consistent basis, getting people such as that to show, to teach the dog just to be a little bit calmer within the home setting, and teach that, the handlers or their owners different ways of engaging with their dog in a much more productive way.
And I think we need to be a bit more honest about these really highly aroused states. And what I'm going to do, guys, for all you followers, is Sarah Heath is very hard to pin down. She's very hard to pin down. But she's been planning to come back for a long time, and I will promise you that I will get her on one of these lives, because I think owners, it would help them understand that a dog is allowed to be happy without whale eye, without a grimace, without the ears like, if you saw your kid absolutely high on E numbers permanently, you'd be like, this is a problem. We have started to categorize our dogs as only ever being happy when they're really, really
when they're wired. Absolutely, yeah.
And I actually enjoy seeing Luna really calm. When and another thing I've noticed with Luna, and I'm learning as I'm never going to be a behaviourist, but I'm really interested in the area. If she's done a lot of high, not high impact, but just energy expending activities, lots of running and it takes her quite a long time to calm down. And if I brought, when she comes home, when I was in my van, she'd just ransack the place. And I'm like, geez, I thought I'd warn you out. But this belief that you can wear dogs out, sometimes I get a bit twitchy about hearing that. I ran him until he was worn out. I'm like, was he in pain?
I think generally as well, it's just that people sort of, when they take their dog out and try and sort of run them into the ground to get rid of their energy, what they're ultimately doing is that they're actually sort of making their dog to a certain extent fitter and fitter and
Yeah.
fitter and fitter and fitter, and they're making it harder and harder and harder for it to expend its energy in a productive way. So certainly with the two dogs that I have, when they were a lot younger, I invested quite a lot in doing some dog training with a great group down the road, and so the trainer that we were using, she was saying, 15 minutes of really productive dog training, sort of gentle obedience work, and so on and so on. You'll be surprised just how sort of energy sapping that is for a dog.
Yeah.
And true to a word, 15 to 20 minutes worth of that sort of stuff is really productive.
I got told off that I'm always moving around, and people are like, "What are you doing?"
I think mine have been banished to the living room at the moment because they will come in here for squeaky toys and create mayhem.
Oh yeah. Luna normally brings the squeaky toys. Somebody's just asked a question, a very specific question. Have you ever heard of TheraPlate? I use one in my hydrotherapy practice and I get great results. I know a bit about them only because I went on some CPD run by the University of Nottingham. I'm going to let you lead because
I'm going to be really honest and say yes, I have heard of the TheraPlate. Have I used it? No. Could I categorise what sort of effect it has and so on? No. So I don't know too much about them, if I'm honest. So yeah, sorry, that was a rather sort of short answer to that.
It's a bit negative. I'm afraid I'm in a bit of a negative category as well. I've never used one. I was at a CPD event and a lady very experienced in the equine industry, because they're all the rage at the moment in the equine industry, was talking about the clinical evidence regarding TheraPlates and whether there is anything to work from, and it's non-existent. Or so I'm sorry if I've offended anybody.
Well, just on that point, actually, and we discussed this earlier, didn't we? When we were talking about sort of the use of some of these expensive electrotherapy modalities that sort of, have their place, but should they necessarily be the go-to each and every time? It just raises a little bit of a question in my mind, really. I'm not saying that they're not useful, but in the first instance, particularly with those sort of mild to moderate cases, are there other things you can do before an owner starts to have to invest in sort of rather expensive modalities, which, yes, they have effects, but do we need to use them straight away? I wonder.
No, and I think that's really interesting. I'm just going to give you a bit of a similar thing like TheraPlate. I hope you're not offended. I'm sure you are having great results. And as long as you're objectively measuring your great results to make sure it's not caregiver placebo and it's not what you want to see, it's fact, then fantastic, because the more tools that we get in our toolbox, the better, as far as I'm concerned. But things like Shockwave, I've spent the day, phoning around different referral centres, asking people the experience of using shockwave therapy, and it's a really new modality. It's been around in the equine world for a while. It's coming into the small animal, but strong clinical supportive evidence is still lacking.
It's still a bit vague, yeah, definitely.
It's still very vague, and therefore you kind of sit there going, do I use it? And I've spoken to quite a few people today, and I've got a really 50-50 feedback on it. It's exciting. So how do I integrate this therapy into my approach? Well, I make sure that I get objective information before and after to make sure that I am not succumbing to the want for it to work and it actually has a true place in my therapy plan. I say that quite strongly because before I started learning massage skills, I would have poo-pooed it 100% because I was taught a very Western-based, pharmaceutical, typical vet approach. And the idea that lateral weight shifting and therapeutic exercise, I want a little bit of myofascial release, you're going to be joking. I would have been, no way. And it wasn't until I actually started learning more about it and incorporating it into what I did. I was like, take that back, Hannah. I never want to poo-poo anybody's, interventions. I just want people to be honest and collect data and make sure what we're seeing is truth and not wish, if that makes sense.
Yeah, absolutely. And it's kind of, when you look through the evidence to back up physiotherapy and what we do, particularly in the human world, there's always one study that encounters another study, and so on and so on. So you have to kind of, look at it sometimes with a bit of an open mind.
Yeah.
And then certainly when you start extrapolating that evidence and using it in the veterinary setting, and you look at the number of studies that sort of report the beneficial effects of physiotherapy in the veterinary setting, they're surprisingly small. So I think when you're using some of these things, it's kind of, as I say, I'm not decrying them, I'm not saying that they don't work and stuff like that, but it's kind of use them with an open mind. And this is the bit that I kind of, that sticks with me more than anything else, is if you've got owners that are kind of short on cash and so on, it's kind of, is there things that they can be doing more effectively themselves, and can you empower them themselves to look after their dogs, rather than sort of maybe getting them to come in for expensive modalities which might be sort of 50 quid a pop, and then you're sending them out the door, and you create this chain where they just keep coming back for this particular intervention. I think
totally agree. I mean, it'll make you all cry, because I think something that definitely drives Cam is this little beauty of a story. Old guy, he must have been in his 80s. It was Christmas Eve. I was working in Brighton, and he brought in his 8-year-old obese collie for a walk, and he had to put it to sleep because he himself couldn't manage the needs of the dog. And he went home for Christmas on his own. His best mate was gone. And I just feel that we failed him then. We really could have managed that better with weight loss. Oh my God, check this out. I've got staff tonight. It's not beer. So I feel that, there were so many things that we could have done that were low income. This guy would have been a pensioner, but we could have helped him with his house, and we could have helped him with his exercise, and we could have helped him with his weight loss, and we could have identified pain early, and he could have understood what his dog needed. He didn't need to do laser. He didn't need to do all the electrotherapies. He still could have done an amazing, amazing thing for that. So let's now go on to the younger dogs, because I never realised, I had a big dawning about what an emotional roller coaster this is. So your dog, let's use another common example. It's going to be a black Labrador, and it's 8 months old, and it has got hip dysplasia, elbow dysplasia, and it's already got reasonably significant change with OA. We've had one in the hospital today, 6 months old, osteophytic train all around the acetabular all around the femoral neck, flattening of the heads. We're talking about progressed arthritis at 6 months. What can we do for these guys?
So, there's various things you can do. So again, it's kind of measuring and sort of educating the owner in the first instance, measuring their expectations as well. So what do they have in mind for this dog, sort of longer term throughout its life? If they're still thinking of doing agility or sort of high impact sports, well, that's going to need tackling sort of at that early stage as well. So we can then sort of look at sort of exercise regimes as well, to try and sort of get the joints functioning as healthily and as well as they can. And then sort of you can demonstrate to the owner how to do sort of certain massage techniques, how to, in particular, to look for certain symptoms which may suggest that the symptoms one particular day are worse than another day. So teaching the owners, when is a dog sort of starting to offload one side to the other, even though it might be subtle, we can teach them those sort of things, so they can then learn over the subsequent days to taper their exercise accordingly.
I think that's brilliant.
So massage, we can teach them, when to use cold therapy, we can teach them when to use heat therapy, and so on and so on. Sorry?
It's the lady who sent me the most amazing video about a year ago of her young dog having been diagnosed, I think it was hip dysplasia, and she videoed herself going on a walk, just a walk, and all of the obstacles that she turned into therapeutic exercises. So every day of the week before work, she had her route around the town, but she'd go up and down steps, she'd weave through some bollards, she'd on off the curb, and I was like, I think you're amazing.
Yeah, and that's really good, because I guess the other thing with these treatment plans is they have to fit in with people's lifestyles and so on. So it's kind of, if you can get them to do a certain exercise just before the dog's going to be fed, great. If you can do certain, like you say, like your weaves or your simple stepping over poles when they're on a walk, great. It's making it achievable on a long-term basis, because if you start sort of setting stuff that's too onerous, then owner interest drops off quite quickly. It's keeping them motivated. Just keeping them motivated to do the simple things well long term.
Yeah. No, I totally agree. And as you said, I think the hardest conversation with this owner was that this is for life, and I think a lot of people go, all right, I'll just do the 12-week rehab and it'll be fine. I'm like, no. This is exactly. It's a bit like ivy. It's going to keep growing back, and it's going to upset the apple cart. So you have to be quite on it. I think, we've got more and more things that are becoming available for these dogs and these owners of younger dogs. So I'm hoping that the CAM world can make that owner feel that they have options with fun stuff. So we don't have to have the high impact, the long weekend hikes, the mountain climbing with your dog and all of these sort of things, and the jumping in and out of the cars, all the things that show a really young, virile dog. There's so much more that we can do, isn't it? So Luna, because I'm paranoid that she'll get a problem, we won't be doing anything high impact. I have no reason to be really, really avoiding of it, but I've chosen to scent work with her. So I go to a scent class.
Brilliant.
And lots of mind games, and I'm just aware. So let's lead.
Well, I was going to say, I think that again it leads into kind of the whole animal behaviourist good dog training. So if you've got good dog training, you've got good animal behaviourists that can show you these techniques to keep your dogs engaged, and make it fun. And as you say, reduce that high impact stuff, then brilliant, go for it. I'd rather, in some cases, people invested in that sort of thing than the other bits and bobs.
Yes. Yeah, I totally agree. So any insurance companies, if you hear people like me and Andy putting into our prescription plan that they need to have an aliquot of money to see a behaviourist to ensure that the management plan we're putting in place is sustainable and the dog stops, jumping up at the windows. That's a common one. Because I've done house visits, I've been very blessed with being able to see behind the door, and the collie that runs out the door and chases the squirrel up the wall, all the way. And then you've got the terrier that sees a pigeon on the garden lawn. One of my cases that wasn't getting better recently, I was like, what is going on? And finally, loads of digging. And the dog still, when it goes for its evening wee, chases the black cat next door down the garden. You're like, right. Yeah, and there's often one of those things, isn't there? I was talking to Gwen earlier, and she was saying that she dug down, and they still had a dog flap, and the dog was clipping its knees in and out the dog flap. And there is often something that still triggers, so you're not getting anywhere with your plan. You're like, why? Let's talk about young dogs. We're going to be doing it in January. The lovely, lovely Catherine Cowley, our social media captain. She basically runs Twitter, Instagram, and Facebook. So thank you, Catherine. You're amazing. We're constructing Action Against Arthritis. So hashtag Action Against Arthritis in January. And we're going to focus a lot more on, as you say, more preventative, more action to prevent progression, being mindful of the impact of the environment on this disease. So all you guys that believe that arthritis is either traumatic from serious injuries or genetic, nah. There is a lot of other things happening in the environment and in your day-to-day life and your hobbies and your activities and your habits that will be affecting this disease. Take it away with your thoughts on this.
This is the other end of the spectrum, and it's kind of we've spent, I think, quite a while sort of talking about what do you do with your dog when it is arthritic. For me, the focus needs to sort of shift a little bit. So it's to how do we sort of prevent that in the first instance. Now, I've heard arguments saying that if you've got something like a Labrador that's it's already predisposed to something like elbow dysplasia, then it's going to get arthritis. Well, okay, well, fine. Surely if we put something in for these dogs early time, maybe might not stop the arthritis, but maybe we can have an effect on the severity of arthritis that it goes on later to develop. So if it's got an abnormal joint, let's not abnormally load it for the next 8, 9, 10 years of its life. So we're about to sort of launch a little project with the lady that I was talking about earlier, who's a dog trainer in Southampton, and we're going to start introducing.
Figure out. Tell us who she is. You know, you're allowed to.
So she works for this. She runs the Southampton Dog Training Academy, and she has puppy classes. So she and I discussed this the other weekend, and this is where, you know, it's trying to get those owners at the early stage of their dog's life, and trying to get that empathy or that understanding that their dog's anatomy pretty much mirrors their own. And sort of try and put in place some thinking about sort of healthy levels of exercise at that early stage. So as the dog progresses, they've always got it in mind that, you know, sort of things like sort of high impact sports, or indeed excessive ball throwing and so on, could be detrimental to their dog at some point. So I'm not saying, you know, remove all these things that they like doing, but certainly trying to sort of moderate their behaviour as time goes on. It was initiated a little bit because when I think back to, you know, certainly when I was a kid and we had dogs and so on, there was this kind of unsaid understanding that
they're bomb-proof.
They're bomb-proof, yeah. It's kind of, dogs are just dogs, and dogs do what they want to do all day long. And, you know, we used to, back in the day, we used to throw sticks for our dogs as well, and we just used to throw them and throw them and throw them and throw them. We had, you know, a couple of border collies, and then exhaust them, and by which stage, you know, their tongue's lolling out. They've got a nice wide base of support because they're absolutely knackered, and then we sort of drag them home, sort of thing. And the dogs seem to enjoy it, so we're going to do the same thing time and time again.
Yeah. Which, a take-home message for you guys: you've just witnessed me and Andy both say that we have made the mistakes, and
absolutely, yeah.
I think I made every mistake with Holly. You know, I missed noise phobia, I missed nerve root signature. You know, I missed so many things. And I enjoyed running on the beach with her, unstable surface. All these things, I did it. The only thing I didn't do was weight loss. She wasn't overweight. So, yay, me. But the reason that I think that people are quite comfortable and coming on here is because, having made the mistake, we so don't want other people to make it too. And we are trying to help you to learn from what we did wrong. So yes, continue.
It's not necessarily you're going to eliminate the problem of arthritis. There's nothing as bold as that. But, you know, maybe we can have some impact later on in the dog's life on the severity of arthritis. You know, if it's going to happen, it's probably going to happen. But, you know, can we moderate it to some extent? I will caveat that I've got no sort of hard-hitting evidence to say it's necessary, suggest it's going to work. But I think, you know, if we start trying to develop at least some sort of empathy for a way, you know, a dog fits together, and then sort of teaching those owners at the early stages about those subtle signs of lameness. So if they think their dog is becoming, so they can watch out for if their dog is becoming sore, rather than waiting to take it to the vets when it's suddenly non-weight bearing lame, because by which stage it's already too late.
And I'm going to butt in there. I think for me, my big learning curve, as I say, I'm not ashamed to say I'm not an expert. I'm on a journey. I've often seen dogs walk in to me, and I'm like, oh, am I going to find out where the problem is? You know, and they cope very well. And then you start peeling them, and you're like, fucking heck, you've got some serious pain here. So the time for me for that is, they quite often is very subtle. It doesn't mean it's not significant. And when I mean significant, I don't mean just the pathology, I mean the pain. Yeah. They are incredible. My best friends are dogs. It's just inspirational animals to me. They tolerate a lot. So can we please stop saying it's just a little bit of pain until you've actually had a full clinical examination, a good assessment? Let's not diminish it. It could actually be quite significant pain, and that dog is just a beautiful dog.
I think the bit that winds me up a little bit when they come into practice, I guess, not in, you know, it's no fault of the owner or anything like that, but it's when the dog comes in, it's struggling to weight bear, and they turn around and say to you, do you think he's just got into the habit of doing that? And I'm like, no. No, it's sore.
It really is really difficult when you're so passionate as I am about it, and people say, "Oh no, it doesn't really hurt because you wouldn't do it otherwise." You know, it's no for otherwise. You watch the dog onto the. No, it's more complicated than that, and that's why getting behaviourists in and getting them to contribute their wealth of knowledge about why dogs will do stuff. Because you know, I love this example to people. Am I in pain? Yes, I am. My toe hurts. It's not gout. Got IT band pain. My hip flexor sore. It's causing pain in my lower back, my upper back. Am I at work? Yes. Am I leaning over doing hydrotherapy in the underwater treadmill? Yes. Am I leaning over to the table to do, surgical interventions? Yes. Do I drive home? Yes. We all do cope amazingly well with pain, but for some reason we seem to then just dismiss that it could be a possibility in dogs. Oh no, you wouldn't do that for her. Oh, yeah, let's think twice about that. So there's a little bit more. Oh, no, Karen.
So, yeah, I was going to say that, once dogs are showing that, I think that level of lameness, they're really stoic and they're really clever at kind of sort of hide it up. But, once you've got a dog to that sort of stage of lameness, I tend to say to owners, once it's like that, they're really sore by that stage.
They are really, really sore.
They're really struggling at that point. So it's kind of.
Yeah. And all the people that work with me know that it can just get you down. A number of us on the Greenside team. Well, Stacey's got pain, Catherine's got pain, Leanne's got arthritis pain in her hands, and all of us are just like
we're all broken.
but it is. It's just like, but we're still at work and we're still getting on with it. So let's talk a bit more about these younger dogs. So and then we'll give a few minutes on that.
Yeah.
And then we're going to do the 10 top tips. I don't think I didn't warn you about this, did I?
You didn't, no.
Yeah, so you're going to be really on the cuff. So it's going to be proper truth from you. You're not going to be smart. So with the younger dogs, the sort of things that I wish people would be aware of is weight control, not when it's a problem, all the way through life. And we know that has got good evidence behind it.
Yeah.
I really wish that people would avoid high impact activities, especially when they're young and when they're not physically able. I would not start going for a run now, having not run for nearly 6 months to a year because of my toe. I wouldn't let's go and start doing a 6 mile, uphill run because I know I'd be really sore. So they've got to be physically conditioned. So consider what you ask of your dog, and neurochemicals are very, very powerful things. They will allow that dog to go above and beyond what they're physically capable of. So bear that in mind. What kind of things would you add?
Say again? So what do?
So like preventative for young dogs, slowing progression, potentially disease modifying, etc.
What do I suggest to the owners that they do?
Yeah, so like younger dogs, what sort of things do you feel really that you need to tell people? Consider this, consider that.
So it depends what they want from their dog to a certain extent. So with the younger dogs, you've got somebody saying, "I want to go into agility" or something like that, and it worries me a little bit with kind of they then sort of go off to a circuit and they start sort of charging the dog up A-frames or to getting it to do tight weaves and so on without any build-up training first. So if they're going to choose to sort of engage in those activities with their younger dogs, it's kind of make sure you do your homework with the people that you're going with in the first instance. So if you want to do those activities, somebody that's going to progress your dog sort of gradually through the stages to go and do whatever it is that you want to do. If it's just that you're going to take your dog out in the park and sort of play toys with it and play ball with it and so on, there's little simple things you can do, sort of like a warm-up to try and get the dog sort of prepared for any sort of activity like that you're going to do. And then I guess the key for me as well is you don't need to do high-intensity walks.
You're getting smaller.
Sorry. You don't need to do the same thing day in, day out. Make it varied, change up the nature of the games that you're playing with them, engage with them a little bit with different sort of training tips and so on and so on. So it's variety. Don't do the same sort of high intensity.
Yeah, and I think I learned this the other day. I think this is Kathy Murphy. I have to say thank you to for this. Is that we look at the body growing, and we really focus on the body growing and the muscle developing and turn into a magnificent beast and a great coat, and he's got good posture. The brain is still growing. The brain,
yeah.
got neurons that are desperately trying to form to have good behaviours, inquisitive minds, coping strategies. We need them to learn coping strategies. My biggest fear at the moment is that Luna is too much of a princess and she's got no emotional resilience, because if I say boo, she's like
Yeah.
So we need to think about it not just as a physical outer being, invest time and energy into their brains and their functions and their emotional state. I think it's really important. I was going to say something. Flooring. Yes. Okay. I've got a big problem at the moment in that, and all the ambassadors can see this now. You go on Facebook and you're scrolling through, and because Christmas is coming, new dog toys are coming out.
Yeah.
On laminate floors, and toys that roll around and the dog kind of flies past.
Yeah.
So that would be my big no.
So laminate flooring, tile flooring, polished wooden flooring, and it's not just toys on the wooden flooring as well. I've been to owners' houses, and the dog comes flying down the stairs, hits the tile flooring, and then slides beautifully across the corridor and sort of crashes into the wall or into the door and stuff like that. And I say, well, how often does he do that? Well, every time somebody comes through the door.
Yeah.
You start to sort of build that up and multiply that over time, and you can see, these sort of things are potentially a problem. And dogs need grip, and it's kind of, you see these toe grips, you see paw wax, and you see all these other sort of things that you can sort of plaster all over their feet and put little boots on and stuff like that. But it's having the motivation to keep reapplying those bits and bobs. Just get some rugs and runners down. It's kind of,
I can buy you a beer.
Well, it's one of the most simple things you can do, really. Just rugs and runners. I'm sorry it might sort of spoil the look of your wooden flooring, but at the end of the day, it's cheaper than having to take your dog.
I say, and I am not ashamed, you will get used to the sight of a rug. You will not get used to losing your dog.
Absolutely.
And it's so freaking obvious to me. I'm not gonna retract that. We've been going for like 70 minutes, so let's crack on with the top tips. Now, I'm going to start with 10 because it means that you end up with number 1, because I keep getting number 1 and I say the same thing. So I'm going to leave that. The pinnacle comment, number 1. So I'm going to do 10, you do 9. I do 8, you do 7.
Okay.
So these are tips. Now these are core tips. These are things that you say day in, day out, that make a massive difference.
Okay.
Very conscious that we have a very wide following from different countries, from different financial capabilities, different physical capabilities. And I never want anybody to leave any of our lives feeling guilty that they haven't used an intervention that we've talked about. So bear that in mind. So number 10, I'm going to lead straight on from what we just said. Flooring. Dogs need traction. And if you have weakness, pain, instability, lack of function in a limb or limbs, it's a recipe for disaster. It's bad enough when they're fully able. I really, really think that, look at your flooring. It is the best advice I can give you. Number 9. Where have you gone again? You keep
Sorry, it's just because I'm having to hold my phone, and you said I've been holding it for 70 minutes, and my fingers are just sort of beginning to play out.
Who was that comedian that used to do the man with the nose on the brick wall? Because it's like,
where's Wally, isn't it, or something like that?
Cool, number 9. You.
So number 9. So change the nature of the game. Okay, so there's probably sort of the early stage. Don't do the same thing day in, day out. If you want to play toys with your dog, sort of vary it a little bit. Sort of, you don't have to do the high intensity stuff day in, day out. Get it doing search games. Just sometimes just take it for an ordinary walk. It doesn't have to be all about sort of bish bash bosh, as it were, sort of thing. One day, if at the weekend, if you've done 2 hours walking, then maybe the following day, sort of 2 20-minute walks are fine. You don't have to do the same thing day in, day out.
It doesn't make you a bad person to rein it in a little bit,
No, not at all. It's kind of
down days. We have video days, movie days, etc.
That's not saying don't go out and exercise your dog. That's just saying, you don't have to do the same thing day in, day out.
No, totally. Number 8 is a little bit of a spin on a common one. I'm not going to say weight loss. I'm going to say get somebody else to critique the weight of your dog. I see this so often where people come in and go, no, he's a fine weight. And I'm like, dream on. No, it's not. It's very, very hard. And we know from studies that owners find it hard to assess the weight of their dog. You're emotionally involved. You see the dog on a daily basis. It is very, very hard for you to give a clear, assessment. Get somebody else to do it for you. Go down to your vets and ask the nurse to be honest and say, it's okay. I've prepped myself. I'm emotional. Give it to me. Because there is also this need for the veterinary industry to not hurt your feelings.
Yeah.
And I've seen it many a time where people go, oh no, he's just a bit tubby, when they need to say, no, he's a body condition score 8 out of 9. He is seriously overweight and we need to be addressing this now. So get somebody else to assess your dog for you. Number 7, no. Where are we? 10, 9, 8.
So I'm 7. Am I 7?
7.
No. You said 4.
6. I can't. 10, 8, 7, 6.
It's getting late, isn't it? Learn to understand your dog's anatomy. I'm not saying you need to be a sort of physiotherapist or sort of a vet to understand some of the basic anatomical structures of your dog, and just have basic understanding that some of these structures mirror our own, and then if you don't use them and abuse them, as it were, sort of thing. So look after them a little bit. Basic understanding that, it's kind of have a little bit of empathy.
Yeah, Danny says something really good about this, and it's just it's a teaching tool rather than dead on fact. But your dog only has a certain number of jumps in them, and use them wisely. And I think that is, you can't really substantiate that, but it just makes people step back and go, ah.
Yeah.
So number 5 for me would be interactive feeding toys. It always makes me. I'm always surprised when people don't employ this. I question myself, where did bowl feeding come from? Where did it come from? It's a convenience to us, it's a convenience to them. It's for us to make sure that we can give it in a set place at a set time. It's not going to make loads of mess. And I'm a massive advocate for licky mats, Kongs, interactive feeding toys, maze bowls, because we all know that our dogs love eating, and at that point they're in a very happy place and the brain chemicals are happy brain chemicals. Let's extend that feeding time. Pain is in the brain. We can influence it by distraction, contentment, satisfaction, etc. These are really positive neurochemicals that can have a good impact on pain. Number 4.
So probably it's a bit of an abstract one, but bedding. So if you've got particularly for your older dogs that are really sore and really struggling, good supported bedding, I think, is a must. So sort of decent memory foam beds, which will help cushion their joints a little bit. Particularly if you've got a dog that's, as it gets older and starts to become a little bit more sort of recumbent, trying to sort of avoiding these sort of pressure areas and so on with good bedding, I think is a useful thing to have.
And the CAM followers taught me a really good phrase about this, but they have got to have choice. They have to, if they're choosing not to be in that bed on a repeated basis or something, there might be a reason. And I now look back with Holly, and there were days that she actually wanted to lie on a hard thing, and I just wonder whether that was because something was really throbbing and she just wanted that pressure. I don't know, but force them. But I totally agree with you. Bedding is often overlooked. On the same vein, warmth. We're coming up to the cold season here, especially in Scotland. We really overlook such a common sense thing. These coats, they're not there for fashion accessories. If you want them to be, they can be, but they can be a part of your toolkit. Keeping these soft tissues nice and warm will actually dull some of the pain. And my dad has stopped coming to the pub with me because he doesn't want to go out in the cold, because he's got a replacement hip, a good other hip, he's got arthritis there, here, everywhere. And he doesn't like going out in the cold. And I sit there going, empathy, let's keep these dogs warm. And by the way, we've had snoods created for dogs for this season. So go on to the shop. Number 2. Oh, we've done this the wrong way around. You must...
It's because it's nearly 9:30, isn't it?
Really tired. Anyway, do another one and I'll do one more.
Okay, jumping out the back of cars is one that winds me up a little bit.
Yeah.
So particularly, the fashion now is to kind of have SUVs and sort of high back cars and so on. And dogs jumping out of high back cars, smashing down onto sort of hard tarmac surfaces. Again, this is going more for the preventative side of things. Think about it a little bit. Sort of, if you've got those dogs which are predisposed to things like elbow dysplasia, maybe early on in their life, think about ramps and stuff like that, rather than every time you're taking them out, jumping out of the Land Rover and crashing down onto their forelimbs. It's
Yeah.
kind of.
And do you know what? I think there's a lot of like marketing and belief behind this, because you can just imagine it's like a man's aftershave advert, and he's there and he's got his tweed jacket on and his dog leaps out of the car, and it's a sign of like, my dog. And he's like, no. And the advert wouldn't have worked if he got the round.
I think one of the worst ones I saw, and I just listened just a little bit, sort of dumbfounded really, was this Land Rover pulled up at the park where we walk our dogs occasionally, and this black lab shot out of the back of the thing at high speed. And the guy went round to the back of the car. He took out a tennis racket and a tennis ball, and he just stood at the end of the park. No warm up for the dog, no nothing like that, and just then hammered this ball, God knows how many times, up and down the park. By the time we'd got round and we'd finished, his dog was absolutely hanging out. His tongue was down by his paws, and it just looked a mess. He jumped in the back of the car and off he went, and it was just, oh my life.
That is a lack of understanding, because that guy loves that dog.
Yeah.
To the park, and he wouldn't have had a Land Rover that could fit the dog in the car. Whatever it might be, that guy does love that dog, but he is totally misled in what is appropriate for that dog, which is sad. For me, another one. Just don't worry about what other people think. Now, this is because I went to one lady's home and she had, I think it was a 14-year-old Westie, and it was still doing the stairs. And she's, the dog was struggling, and, it had a couple of falls. And I said, you're capable of lifting your dog up and down the stairs. Is there a reason not to? She went, well, I'm worried that people will think I'm over the top. I was like, no, that's fine. But she was really quite concerned that other people's opinion of what she should and shouldn't do with her dog would it affect her negatively. And I was like, no.
That's what people think, quite honestly. It's a kind of.
I know.
Yeah.
I know. And that's one of the lovely things about Holly's Army. All of you lovely Holly's Army followers watching this, you have created you've dealt with the taboo about dog trolleys, these dog walkers that you can, big dogs, small dogs, push trolleys, dog trolleys, whatever you want to call them. I love them because they really appeal to the needs of that dog, which is, environmental change, stimulation, distraction, all of these things. It also helps with the mental health of the owner, that they can get out and go places. And you, Holly's Army, have really dealt with quite a big taboo about it. So well done, thank you guys. I'm going to give you one more, and then we're going to call it a day.
Okay. So did we talk about dog training and dog behaviour?
We did, but that was a tip.
That was a tip. So that's probably my number one. When you first get your dog, and you first get your puppy, get it engaged in good, productive dog training. Sort of, teach the dog patience, sort of basic commands, basic safety commands. If your dog's heading off chasing after a rabbit and it's in a main road, you need to call the thing back before it gets clobbered by the car. And so many people, bless them, they get their dogs and they don't do the basic commands. Those basic training commands, So, get on board the dog trainers, get on board with the dog behaviourists. And if you've got the sort of lovable lunatics at home that are bouncing on and off the sofas, throttling up and down the stairs because they're just high on life all the time, then, get one of these guys to come round. And I think it's probably money very well worth spent in the long run.
I had a behaviourist. Hands up. My dog, I needed help. I'm not ashamed. I go to training. I do not have the answers, etc.
Well, there's been a few patients now that I've had. We've done this the rehab, and we've done the treatment, and so on and so on. And we get to a stage where I say, look, I think I've gone as far as I can for you. And I said, I think your next best option is to get a dog behaviourist that knows their stuff to come around, uses positive reward-based sort of training techniques. I think that long-term is going to do more for your dog than you coming back every so often and you just massaging it.
Yeah, totally agree. We've got one question here that we're going to leave on because it's a really good one. Do you think we can overprotect joints, which may lead to the development of early onset OA in animals? I think you can go to the extreme, yeah.
Oh, absolutely, yeah.
It's not got any kind of proprioceptive development. It's got no, soft tissue function, stability, strength, stamina. Yeah, I think we can do that. But you add to it. Go on, go for it.
Yeah, so certainly, and I guess if you have a dog which you don't exercise and you don't engage with and so on, yeah, it will fundamentally become quite weak, and those joint structures and so on will not be optimized and working at their best sort of level. So it's about moderation, isn't it? I'm not saying don't do anything with your dog, absolutely not. But it's it's all about extremes. You don't abuse it and lose it. But at the same time, so don't not use it and lose it. It's kind of finding that happy balance. It doesn't have to, at the same, I've said it doesn't have to be high intensity all the time, but yeah, equally, you do need to exercise your dog. And there are sort of basic exercises that, if you get, you speak to a physio and so on, there's some very basic generic exercises that you can do long term to help protect your dog's health. So, one of my favourites is things like sort of, the kind of pick-up sticks orientation of cavaletti poles that you get, so you vary the angles and all that sort of thing. It's a fairly safe exercise to do, and it's a great way of building up proprioception and so on.
I used to do that.
If you're out with your young dog and it's fit and healthy, sort of slow walks up and down hills to sort of build up those muscles in its own, it's great. I've got no problem with dogs doing stairs well and doing them safely if they know using a nice reciprocal gait pattern as they go up and down them. Perfect, all those sort of things are great. And if you get on board a good sort of physiotherapist and you want those preventative strategies to be taught to you and so on, then I think again that's money well spent.
That's an area, isn't it? I know that there's now body conditioning, and I know that there are people beginning to mention about pain awareness in puppy classes, but bringing a proper physio approach into so it's like prehab before OA, a bit like prehab before surgery.
Yeah.
That's another conversation.
Yeah.
We're going to do lumbosacral disease. We're going to do more about like preventative, muscle development, function, stability. So that's already 3 times you're coming back.
Okay, that's fine.
From now onwards. Thank you so much.
You're very welcome. Sorry about the 5 minutes. As I say, my fingers are sort of beginning to sort of slowly.
I'm going to send you a tripod.
I tried balancing on various things. Sorry?
Thank you guys. If you would like to put any questions underneath, I'm sure that me and Andy will get to them at some point. But otherwise, I'd like to say thank you, Andy. You've been absolutely fab.
You're very welcome. No problem at all.
I hope that we will get you back in the new year. So see you later. Till next time.
Bye-bye.
All right, let's do this.